Hello everyone, I am Dr. Varsha Reddy, Consultant Pediatric Neurologist working at Yashoda Hospitals, Hyderabad. Today we'll be talking about mental health in children. October 10th is observed as World Mental Health Day. The theme of World Mental Health Day 2023 is Mental Health is a Universal Right. Our minds, our rights. Raising a child can be challenging. Even under the best circumstances, behaviors and attitudes may change. All children are sad, anxious, restless, or aggressive at some times. But sometimes it is difficult to get their concentration to do certain things. Sometimes it is also difficult for a child to talk to others. These behaviors can be just a phase of a development. But sometimes these behaviors can also seek to an underlying condition. Mental disorders can begin in childhood. For example, ADHD, autism, anxiety, mood disorders, PTSD can very well start having symptoms in childhood. But how can we tell the differences between these challenging emotions and behaviors which are a part of a growing up phase or they are cause of concern? Consider seeking help if the behavior changes persist for weeks or months, and if it is distressing to the family, to the child, and if the child is not functioning at full potential in the school or at home or with peers. What are the behavior changes that you can identify in young children? If the child has frequent tantrums and it's irritable all the time, often talk about fears or worries, most common kind of symptoms. They complain of headaches, stomach aches multiple times repeatedly but without any medical cause. They either sleep too much or sleep very less and have a lot of nightmares and also are falling asleep during the day. If a child is not interested in making friends or prefers to be alone. If your child struggles academically or recently has a change in grade or a lower grades. Repeat actions or check things multiple times because of something bad might happen. These are some behaviors that you can identify in young child. But what are the symptoms in older child and adolescents? In older children and adolescents, you can identify if they have recently very low energy and have lost interest in things previously which used to interest them. If your child is spending more and more alone time and is not mingling with your family or is avoiding social events or activities. If your child is following certain diets or exercising excessively in fear of gaining weight, if they are involving in self-injurious behavior, causing some self-harm to them, if they often engage in risky behaviors either alone or with friends, or if they think they can hear some voices which cannot be heard by anyone else, if they have periods of very high energy or very low energy. These are some warning signs that you can identify in your child if they persist for longer than usual or if they persist for weeks to months. First step as a parent, talk to your child. Talk to them about their fears, about their current issues. Talk to their peers. Talk to their peers at school, at daycare, or even at a playground. An evaluation by your mental health care provider can assess your child's behavior and tell them if there are some weaknesses and which the child has to face, and also tell you about your child's strength. Your mental health professional will also provide you reassurance and what are the necessary steps to be taken next. The treatment options available for mental health conditions are talk therapy or psychotherapy, parent support groups, medications, and counseling sessions. Children or not adults, sometimes the medication and the treatments can be given to a child which are prescribed and approved for adults. So always consult the right person who is dedicated mental health professional in analyzing your child's condition. Mental health is an important for overall health. So if there is any mental health disorder, it can interfere with your child's healthy development and may also progress into adulthood. You know your child best. Please talk to them and also be a support to your child.